Welcome to Adapt and Close, and thank you for deciding to watch this video. I have like practice questions on key facts about infectious control and disease, just to keep you focused on some of the things that they like to trap you. So we don't want to be trapped. So if you want to learn how to answer infectious control and disease questions, stay tuned for practice questions. So this is what we have. We have who need immediate intervention. Select or apply. You choose those that you're 100% confident is right. So we got to intervene in somebody's. I don't know who, but you have to take a look at it. It's all infectious control, infectious disease. Who need immediate intervention? It's a select or apply question. So if you think you need it, you pick it. If you're not 100% sure, you just leave it for these new generation questions, so that you don't lose a point. You will never get zero for SATA. A client with what? Sedif, with gown, gloves, placed inside the patient room. Sedif is what? It's a contact precaution, right? All the PPEs should be outside the patient room. You put it on the PPE outside the patient room, come into the patient room, and when you're done, you remove the PPE inside the patient room. Okay, so the PPE should never be placed in the patient room because it's already contaminated. Therefore, we got to intervene in this patient. The client with C. diff roomed with client with the VRE. We have a contact problem. We have a contact problem. What is the principle of rooming? Same organism, not the precaution. These are different organisms, but the precaution is the same, contact. So we need to intervene. You have different organisms, so it's the same organism, precaution does not matter. A client with what? A VRE, room with the client with what? Gonorrhea. What is the precaution? This is what? Contact. Gonorrhea is sexually transmitted disease. You don't get it by touching somebody. Okay, you don't get it by rooming with another patient. You don't get it if the patient cough. So there's no airborne. It's not what? Droplet. It's not contact. It's sexually transmitted disease. So VRE patient, yeah. Will you room with this patient? These usually patients are very, very what? They can transmit their disease. These people are placed in what? Private room, right? They are placed in private room, right? This is a trick question. They are placed in a private room. They have to be in the private room because they can infect other people, right? A gonorrhea patient cannot transmit the disease to him, but he too cannot transmit the disease to a gonorrhea patient. But it's not appropriate to room a patient with a VRE, with a gonorrhea patient. You're going to infect this patient. So that's wrong. We need to intervene. The client post appendectomy, room with the client with rectal bleeding, right? I just had surgery. And this one is bleeding, rectal bleeding. This is not infectious. Just having blood from the rectum doesn't mean you're infectious. So this patient is appropriate. We don't need to intervene. A client with pulmonary diphtheria placed in a negative pressure room. What is the precaution for this? It's droplet. Does droplet need a negative pressure room? No. So we don't need a negative pressure room. Therefore, we need to intervene this patient. So as you can see this patient, their gown and gloves should be placed outside, not inside. The patient should not be roomed with the VRA patient, even though they both have contact precaution. They have different organisms. Okay. VRE patient can infect the gonorrhea patient. Gonorrhea patient will not infect, so we should not place them together. A client post-appendectomy is not infectious, and a client just bleeding, rectal bleeding will not infect it. Unless this patient is having diarrhea, yeah. If I'm just having diarrhea, I may be infectious and I may infect somebody who just surgery. Just bleeding from the rectum, GI bleed is not infectious. Pulmonary diphtheria is what? Droplet. I don't need a negative pressure room. I just need a regular room and then a max by the nurse, surgical mask. Okay, so those are the ones you need to intervene. First one. Second one, which precaution protocol need immediate intervention? That means there's a protocol that has been initiated and therefore we need intervention. So read the question carefully, understand it. Is this select or apply? We're talking about precaution protocol. Okay, transmission precaution protocol that need immediate intervention. That means they're doing something wrong in terms of the disease process. VRE, what do you think? If you have a VRE patient, what is that? This is contact, right? You need a gown, you need the gloves. Do you need a mask for the nurse for routine care for this patient? No. If I tell you they're doing any wound care, other thing that will splash in their face, yeah. But gown, gloves, and masks appropriate. That's the appropriate way to do the procedure. We'll see them. This transmission protocol need immediate intervention because you don't need one. You don't need a mask for somebody with a VRE. Smallpox, negative pressure room, N95 mask for the client, and a surgical mask for the nurse. Do you see the problem? Negative pressure room is fine. Patient does not need N95 when they are in the room. Even when they're going to do X-ray, they just need a surgical mask. The nurse should wear N95. So I need to intervene. C. diff, gown, gloves, soap and water, and wash for the nurse. So if I'm taking care of a C. diff patient, do I wear a gown? Yes. Do I wear gloves? Yes. Do I use soap and water for hand wash for the nurse? Yes. So I don't need to intervene. Scabies is contact. Do I wear gown? Yes. Wear gloves? Yes. Do I use hand sanitizers for the nurse? Yes. You don't need to use soap and water. Hand sanitizers is enough. So no intervention. Shigella, what do you think? Contact, right? It's a GI problem, so it's a contact. Surgical mask? No. Gown? Yes. Gloves? Yes. So I need to intervene. So 1, 2, 5 are wrong precautions in terms of PPE that you're supposed to wear. Once again, if you are confident, you choose it. There's another trick too. If one of the answers is wrong, the whole thing is wrong. So don't pick it. Just because 2 out of 3 is right doesn't mean you should pick it. Next one. A nurse is caring for a client with MRSA. MRSA. Which of the following are appropriate? So I'm taking care of a patient with MRSA. Which of the following is appropriate? Dissect the problem. What is MRSA? That is contact precaution. So what will you institute in terms of the protocol? It's a contact precaution. Apply sterile gloves before entering the client's room, right? I just described it. Every contact, you have to have your PPE before you enter the patient room. So apply sterile gloves before entering the client room. But guess what? Look at the answer choice. Don't just read it through and don't pay attention to the words. It's a sterile gloves. Do you need a sterile gloves? This is a trap question. You don't need a sterile gloves. apply regular gloves, okay, before entering the client room. But you don't need a sterile glove. So which of the following is appropriate? This is not appropriate. The door of the client must be closed. The door may be closed because it's contact. You don't get it by standing outside. You don't breathe in anything. You have to get in touch with the patient, actually physically touch the patient. So the door of the client may, not must. So this is not appropriate. Single-use disposable equipment recommended. Yeah, you want to use single-use equipment that can stay with the patient, and then some of them you can throw them away. Some you cannot, like IV pole. Yeah, you don't need to throw them away. That one can be cleaned after the patient leave the room, but all equipment must stay in the room. Gown should be single use. Some blood pressure cuff, single use. Stethoscope, sometimes simple one, are single use. They stay with the patient in the room. So I like this. It's appropriate. Remove all PPE after leaving the client room. Same thing. For contact, you wear your PPE before you go to the patient room, and before you leave, you remove them. So you remove before you leave, you put them on before you go to the patient room. So coming out and removing the PPE, you contaminate the whole environment. Therefore, this is not appropriate. Use soap and water for hand hygiene. It's MRSA. You don't need soap and water. Hand sanitizers is enough. Even though you say this is appropriate for your test, you got to be like specific. This, whenever we use soap and water for contact, is always safe. Okay, it's not for MRSA, so this is not appropriate. Room the client with another client with MRSA. Yeah, a client with MRSA rooming with this patient is appropriate. They have the same organism and the same contact precaution. So appropriate are only 3 and 6. As you can see, only 2 answers. If you pick all 5, you get 0. If you pick 4, you still get 0. Because 2 may be right and you get 0. So pick the answers you're confident and you get all the points right. Okay? So next one. A client was diagnosed with syphilis. Which of the following is consistent with the disease? So I have a syphilis patient. And so which one is consistent with the disease? You have to know that syphilis is what? Sexually transmitted disease. There's 3 stages. There's stage 1. Usually, first stage, they come in with the genital ulceration. So, yeah, they have genital ulceration. And usually we call it a chancre. It's painless. They don't feel anything. And they can have it in their mouth. And this can last for the first 2 to 4, 6 weeks, and it goes away. And then they go into latent stage. They don't feel anything. No, they go to stage 2. And stage 2, where they have they at stage 2 level, they have like flu-like symptoms where they develop rash in the palm, in the sole of their feet. Okay, and this can last for a couple of weeks, like 2 weeks. This is where they are mostly infectious. And so this is where you want to get them to treat them with penicillin. If you don't get them, they go into latent stage where nothing happened. The symptoms resolve all of a sudden. Then later on, they go into tertiary state. The tertiary state is where they have cardiac issue, neurological issue, and a skin problem, like subcutaneous nodules. So this is some of the stages of syphilis, what you see, how to recognize them. So stage 1, mostly genital ulceration, the skin rash, painless, it's not painful. Stage 2, They have flu-like symptoms and mucopurulent rash in the palm and so, and they go into latent stage, and stage 4, they have cardiac neurological problem. So pay attention to that when they ask you a question, see what are they exactly are they talking about, and answer it appropriately. Okay. So based on what we have, you said penicillin G is the treatment of choice. Yeah. That is the treatment of choice. That's what we use, and it's not a virus, it's a bacteria. So this is wrong. Transmission is by contact. It's not contact precaution. It's by STD, sexually transmitted disease. So the contact is very deceiving. That means if I get closer to you, I touch you, I'm going to get syphilis. No, sexually transmitted. We have to involve in some form of anal sex, oral sex, whatever method that this is, or vaginal sex, whatever, for transmission to occur. Stage 1 is contagious. Yes, 1 and 2 is very, very contagious. Okay, so this is good. Mucopurulent rash in the palm and the sole. Yeah, if you catch them in stage 2, they will have this. Stage 3 is characterized by neurological, this is neurological issues. Yeah, so this one is good. So stage 3 is neurological. And these are the 4 questions related to penicillin that you should pay attention. G, virus is not the virus, it's transmitted by STD. 1 is very contagious, 2, mucopurulent rash in the palm and so, and then 3, they have neurological problem. Okay, neurological and cardiac issue. And so this is all that I have for you in terms of infectious control, straightforward questions. And as you can see, if you know the concept, it becomes an easy problem. You should be able to analyze the question and answer them without any problem. Take care of yourself and all the best of luck. Bye-bye.